MTI fellow, and she has recently started her neonatology grid training in Manchester. Welcome, Nithya, and thank you very, very much for accepting our invitation to come and speak about your experience.
Thank you, Habab. Can you just confirm you can see my screen and hear me okay?
Yes, I can.
Perfect. Yeah. So hello, everyone. Good evening. My name is Nithya. I am a ST6 neonatal grid trainee who has just started my grid training in March this year. So a little bit about me. I completed my post-graduation MD Pediatrics from India and then came over to the UK as an MTI clinical fellow, mainly to pursue my interests in neonates. And I started training at ST4 level and then applied for a grid at the end of ST5. So essentially had very limited time to prepare for my application. And I was fortunate enough that I was successful in my first attempt at application and started my grid training in March. And if for any of you who are contemplating training less than full time, yes, it's definitely possible to start grid as I have done as a less than full time trainee. So I've structured my presentation into two parts. The first one looking at the application and shortlisting, as many of the previous speakers have alluded to. And part two would be the preparation for the interview. If you ask me which one needs more time and effort, I would definitely say part one, that is for making sure that your application is good enough to be shortlisted. As you can see in this picture here, this is from the numbers from this last year. So around 100 people apply. This is for the neonatal subspecialty. 100 people apply for 35 places. So it's almost a 1:3 ratio. So making sure that your application stands out is the first step. So when to start? It's never too early, as the previous speakers have told us their experience. But I would say definitely by ST4, whereas in my case, when I started looking at the grid process and the application, and also you tend to do the tertiary neonatal placement at your ST4 level. So make sure you make full use of that posting. Where to start? I would say definitely by letting your team and your supervisor know that this is your subspecialty of interest. They're always looking for keen, enthusiastic trainees to take up projects, presentations, but you might not come across those opportunities if you don't let the team know. So make sure that everybody around you knows that, yes, you are planning to apply for grid in this subspecialty and you are interested in taking up projects. So how to collect the evidence which are mentioned in the shortlisting criteria. So I would strongly suggest taking a copy of this shortlisting criteria. So take a printout. That's what I did. So this, I'm sure you've all come across it. It's under the resources on the RCPCH website. So the shortlisting criteria, so you take a printout of it, go through and see what you can achieve in each of the domains. My sort of top tip would be to make sure that you work towards doing something in all of the domains rather than focusing all your time and energy on one particular domain. The reason for that is, so if you have a look at the shortlisting criteria, there's only a maximum of 4 points you can achieve in each domain. Say, for example, you've got 2 peer-reviewed publications. You will not get any additional points for publishing any further. So rather than spending time on or being focused on one particular domain, move on to the next one. Say, for example, education. If you have done local departmental teaching, try and develop some contacts or networking to see if you can do step teaching. So that will give you an additional point. And this it's almost like a game where you need to try and score as much points as you can, and that the only way to do that is by looking at that criteria and seeing where you will be able to do so. So for example, here again, if you have the GIC course, if you've been nominated, that's great. Or if you have done the modules which is sponsored by the deanery in Edge Hill, teach the teacher, any one of that again gives an additional point. So a lot of it is about being opportunistic. As mentioned earlier, the audits and quality improvement projects, especially in the subspecialty of interest, will help you greatly both in the application stage and also when it comes up in the interview as a question. It doesn't necessarily have to be in your subspecialty of interest, but if it is, then definitely you get bonus points for that. Bonus points as in not like for the scoring criteria, but especially when you talk about it in the interview stage. And make sure that you are actively involved. So it doesn't mean you're just collecting data or presenting it. You are actively involved in designing it, leading the project, and also when you write in the application how this project has made a difference or how it has brought about a service improvement. And if you have completed the PDSA cycle, then that will be great. So, so the audit or QIP project, make sure that you're invested in it. Even it's not the quantity, it's definitely the quality of them. So even if you have done a couple of them, but you've completed the PDSA cycle and you can demonstrate that it's brought about a change in practice, that will definitely shine in your application. And make sure you use every possible opportunity to present posters, oral presentations, and currently in the current climate where you're able to do these from home, like even an international presentation from home, definitely make use of that. Try and present in all the conferences wherever you get the opportunity. Always be on the lookout. Publications is a bit tricky. A lot of the time it's about being in the right place at the right time. If you've got journal publications, well and good. If not, don't worry too much about it and don't try and spend too much time trying to achieve that. There are other ways you can get points in that particular domain. One of the examples I can think of is writing a book chapter. It does not have to be like in your subspecialty, even a chapter in a medical student book or in like a question and answer preparation one for exams, even that qualifies as a book chapter. So try and think outside the box a bit if you're struggling with tick boxing the shortlisting criteria. The leadership role is another one which might be difficult to evidence. So personally, I applied for like BAPM representative, NLS representative, and then finally for the BMA representative in the region. So it again, if always try and look for these leadership and management roles on these websites, and you will be able to land one of those leadership roles, and that can evidence in your application. And don't shy away from using abroad experience. It does not all have to be what you've done in the UK. So all of us IMGs have done a lot of work back home, which you can use towards evidencing in your application. For example, my research and publication was from my work back home. So moving on to the interview stations, make sure you speak to your peers who have just given the interview in the last season, because it keeps changing the format. So mine was a face-to-face interview, and I think the most useful thing was speaking to someone who's given the interview the last session and just finding out what sort of format it is. You will be getting an email once you're shortlisted about the interview format as such. It goes really quick. I would say that it's hard to prepare for it as such. Like it, to be one of the tips I can give you is, if you've not got this book already, I found it quite useful to structure the answers. So the medical interviews book, it gives you a sort of structure to answer the questions, especially regarding your CV or questions on leadership, which we know the answers to, but we struggle to present it the way they want to hear it. I had a session dedicated to critical appraisal of the journal. So that is something where you can prepare and score points. So brush up on the statistics research. So this book from Past Test, The Doctor's Guide to Critical Appraisal, you don't have to read it cover to cover, but I found it quite useful in answering the questions and also for the critical appraisal of the journal. So be aware of the latest guidelines. Say, for example, around the time of my interview, the BAPM framework for preterm management, extreme preterm management was out. So we knew that there would be a question based on that at some point. So when you're answering, if you reference these latest guidelines or frameworks, then they know that, yes, you are updated and invested in your subspecialty. So in summary, I would say my top tips would be early preparation is key. Don't wait for the advert to be out to then start preparing for your application. Speak to your seniors, speak to peers who have applied before you. The questions are not going to change. So you start preparing your application early. Focus on all of the domains. So don't spend too much time and energy in one domain, because there's only maximum of a certain points you can achieve in one. So make sure you do something in all of the domains. The best tip I got from my senior was making sure that I'm not the only one who has read my application before submitting. So getting comments and feedback from consultants or other seniors who applied was very valuable. We made a lot of tweaks and changes with the application. If you can look at somebody else's application, one of the seniors' application, that will be very useful as well. When it comes to interview, there are mock grid interviews. I'm not sure about this year, but last year Liverpool had one, and I believe there's be one in Scotland as well. If I get any further information, I shall pass it on via the Softlanding team. So that makes, if there is an opportunity like that, definitely go for the mock interview preparation. Brush up on your critical appraisal skills, because you know that there is going to be research-based questions. And when you answer, rather than saying, this is how I would manage an extreme preterm, you say, as per the evidence in this latest framework, BAPM framework of extreme preterm management, this is what would be the modifiable risk factor. So that then says that, yeah, you've just not read the abstract, you know what you're talking about. And as others have said, be yourself. I know you're saying structuring answers, things like that, but if you're trying to like memorize something and say, then that makes it very difficult in the interview. So just be confident, be yourself. You've got this. I've left my email ID here on this slide. So if anybody wants to get in touch for further information or guidance, I'm happy to be contacted. Thank you. All the best and good luck.
Thank you so much, Nithya. It was a very organized talk, and I'm sure you are organized, being a neonatal person.